Welcome to the Amerigroup session. I'm going to talk to you guys a little bit about some of our tools and some of the other areas that we feel that providers, you all should be aware of and that you all should know about. But first, I kind of want to just take a moment to kind of talk through what we are and our mission and our objectives here at Amerigroup. So as you all can see, when you see Amerigroup is focused on achieving health and wellness for the entire family, what that makes me feel like the greatest wealth is health, right? But at the end of the day, I always say a healthy family, a healthy family is always important. So we strive to achieve those goals so our families are healthy in the community. Also, we listen and respect to engage with families to understand the culture, the values, as well as the benefits. And I always say a flower cannot blossom without sunshine. So I believe in creating meaningful, powerful relationships that matter. And also, as we engage and we support the members and the families and the goals that are based on what's important to them, we think about the ability to adapt and to recover and assist those families that have difficult times as well as experiences. And this is a goal, one of the major goals for Amerigroup. And again, I will introduce myself. My name is Rosalind Phillips, and I am the manager for our Provider Relationship Account Management team. Okay, so we have here in regards to becoming a provider. So there are several ways, not several ways, but there's here, as you all see, the process in which we provide for providers to become participating with us. Also, once you're on the web portal, it'll pretty much direct you in that area that you would need to go based on your provider specialty and your type. Provider credentialing and re-credentialing. We all know that now that DCH, Department of Community Health, they are solely the individuals that do the credentialing as well as the re-credentialing. And also keep in mind, with the re-credentialing, that's every 3 years, with the exception of some, if it's a state law, that it has to be different. How we partner. We partner in areas such as this, as conferences. We have joint operation committee meetings with some of our provider hospitals or facilities. We have town halls, education forums, also face-to-face visits that our team does while they're in the community. We have association partnerships, and we have new provider orientations that take place the second and fourth Wednesday of every month. Also, you'll see here some of the tools that we provide as it relates to logging onto Availity, learn about Availity, the reimbursement policies, Provider Training Academy, and all of this is located on our website. We also have the Provider Training Academy, which is located on our web portal. Amerigroup, we really strive to educate our provider community as well as our providers to ensure that you guys are privy to all the new policies as well as the coding opportunities, so you all can be privy to which codes are payable, which codes are not, and we have some awesome tools that are on our portal that speak to that as well. We also have the Provider Pathways e-learning, which is an educational process, that's related to the Amerigroup community. Staying connected. So we want to make sure that you all stay connected with Amerigroup, and we have the information here on how to do so. You can either email, you can visit us on our website, and we also provide the the phone number for you all. Thank you, and that concludes my portion of the presentation.
Hello, good morning. My name is Mary Robles, and I'm the Provider Collaboration Programs Director with Amerigroup. I want to start by asking how many of you all attended the opening session this morning? Same here, and I did hear a lot of great things that I think are going to kind of resonate with you from the message that we did receive this morning as it relates to our value-based programming. Specifically, and I wrote these things down, teamwork is the key to success. I think that's one of the very first messages that we received. And in order to develop programs that are sustainable, that really do impact our members and their outcome, we do have to collaborate with our providers in the development, the execution, and obviously looking at the outcomes that they do have with our members. The other thing I heard was that collaboration drives quality, and that promotes a culture of excellence and improves health care of our members. And so having served as a provider in the state previously, I recognize that very often we have a job to do, right? We need to work with those members, whether we're providing therapy services, whether we're providing physician services, and it's really difficult to do the extra. And that's what we call the work that we do off the side of our desk, to really ensure that we are making an impact. And so that's where our value-based programs come into play. And so as you can see, with these programs, we are working to redefine healthcare. We want to ensure that we are appropriately utilizing our benefits, that we are improving quality indicators, that we improve the member continuum of care, which is another thing that we heard earlier today, is we want to move folks along that continuum of care so that we're moving away from sick care and focusing more on preventative care. We also want to improve our member outcomes. And so our value-based focus with these programs are to improve the health status of covered members. So we are looking at various measures, whether they're HEDIS measures that we want to improve, or just the overall status of the member's health. We have improved quality target results. We want to promote the use of evidence-based patient care or practices, enhance provider operational efficiency. So we're not just looking at what is it that you can do for us, but what is it that we can do to help support you in providing the care that our members need, and then encourage support and provider engagement, right? We want this to be a win-win. If it's a win-win, then we know that we're going to see those improved health outcomes. And so I know you're going to get a copy of this, but if you want to take a picture, there's some contact information on here for our various programs. I'm not going to go into all of our value-based programs, but I do want to highlight the fact that it does touch different areas. So they're either specific to provider, such as pediatricians. I heard somebody in another session talk about autism, so we do have a program that is specific for autism. It's our Applied Behavioral Analysis Quality Incentive Program, and that is really designed to move those members along that continuum, because we know with that particular type of care, there is a bottleneck at the beginning, and it kind of keeps folks from being able to enter treatment. We also have some that are focused on specific types of facilities. So we have a behavioral health facility incentive program, and then our newest program is a PRTF, aftercare incentive program. So we heard earlier that the rates for the PRTF were increased. So that does help them as they're working with those members or those patients within their facilities. But what we're focused on with this particular program is, but then what? What are we gonna do after they've received that treatment and they're ready to discharge? And so our focus is really on that discharge planning. We want to help facilitate conversation and collaboration between those facilities and outpatient providers from the time that the member enters the facility, so that there is a smooth transition of care, and that we are moving the member along the continuum as we discussed earlier. So we do incentivize those facilities that are working on that discharge planning and are collaborating with our outpatient providers. One of the ones that I do want to focus on, though, a little bit more is our social drivers of health incentive program, or we say social determinants of health, but we're calling it drivers of health. We don't want to say that it's a determinant. However, we know that it's really difficult to improve health outcomes if we don't help meet the social needs of the folks that we're serving. And so this program is specifically designed to do that. We want for our providers, and it's open to all providers. This is the great thing about this program, is you don't have to be a behavioral health provider, you don't have to be a physical health provider. You can work in any area as long as you are a provider, and you don't have to have a specific attribution. So you can be a small mom and pop shop, or you can be a CSB and still be able to participate in this program. And essentially what we're asking providers to do is to assess our members. We want to know what are the things that are inhibiting them or preventing them from getting the care that they need. We've also included over the last year the ACEs, so we're looking at adverse childhood experiences so that we can address those. We know whenever somebody scores high in that, they have a high propensity for anxiety and for stress-related disorders. So we want to make sure that we are able to address those. And so after they're assessed, we ask that we have a diagnosis, and these are all separate measures. So you don't have to do all of it. You can do some of it and still receive an incentive for it. We also ask that our providers go onto our community resource link, and this is a platform where providers are able to link their patients with community-based organizations that specifically address their needs. And for the providers who participate in this program, we did enhance that platform for them, so they're actually able to use it with all of their patients. Now, we don't incentivize for those that are not Amerigroup, but you can link utilizing that system with all of your patients, so you don't have to worry about who their insurer is in order to use that. And then closing the loop. Not only do we want you to refer them there, we want to make sure that they did get their needs met. Because if we can meet their social needs, we know that we're going to be better able to meet their health care needs. And so that's just one of the programs that we have that we're really excited about. At the recent SDOH Summit, which was in October, that actually did earn 2 awards for being, thank you. And I want to get it right, so I'm going to look at my notes. They were voted actually #1 for the biggest impact, sustainability, and replicability. So we're hoping that this really does move the needles with our folks, and that we have an opportunity through the programming and through the collaboration to really improve health outcomes. Thank you very much, and I'm going to turn it over to Maria Enriquez, who's going to talk about value-added benefits.
Hello, everyone. My name is Maria Enriquez, and I'm the Marketing Director in Community Outreach. Happy Halloween, first of all. We know we're all about healthcare, but if you visit our table, we do have some sweet treats, because we couldn't just not do it on Halloween. But I'm here today to talk to you about some of our value-added benefits, or VAB, as we call them for shorts. I have put them in place depending on the category. So first we have, of course, a lot of VABs for kids. We have Old Navy and Walmart gift cards for those exceeding in school. We also have a DoorDash benefit for summer, specifically during the summertime, because we know that while they're in school, they can get their lunch at school, but what happens during the summertime? So we have a benefit for a DoorDash delivery. We also have an Amazon voucher where they can get wellness items. That is a $30 voucher. We, of course, cover Boys and Girls Club, Girl Scouts, and Boy Scouts as an after-school activity. We have a special summer reading program for children from 5 to 6, and that's a $50 Barnes & Noble gift card. They can either get it at the actual store or they can get it online, so they can get their books delivered if they don't have a store nearby. Sports physicals, of course, and we have a special oral care essential kit that they can get once they get their dental exam. And it's just a small kit that has toothbrushes and toothpaste and just fun things that the kids will look forward to. Of course, we love our new and expecting moms. And for moms, we have our mom-to-be catalog. So we know they need a lot of essential items while they're expecting. So while they're pregnant, they can get up to $100 to choose from a catalog. We heard a lot of feedback from our members saying, I would love to shop around, or I would love to have the opportunity to choose my items, not only get what you have. And we said, well, you know what, we will create a catalog, and you can go in, you have up to $100, and you can select the items that you need, and then they can get that mailed to their home. We also cover spa package for moms after delivering. We know how important it is to get the postpartum checkup completed within a certain time, especially for quality measures. So we have a spa package. They can either get a massage or a facial when they complete their postpartum checkup. If they do prenatal checkups on time as well, they can get their gift cards, so up to $120 on gift cards. Some of the other items that we also have baby food available, so baby pouches. We have the breast pump, as we know how important it is for those moms. We cover diapers as well. You can choose the size that you want, so we have diapers from newborn all the way to size 5. We have a stroller, a booster seat, and a potty training seat. All of this is available for children meeting the specific criteria. We have a first birthday gift that is for members turning 1, and we love to see moms who are coming to our events and they're expecting, and then they have their baby, and then they let us know, hey, the baby just turned 1, and they got their gift, so we love to see that. We celebrate that. And Sam's Club. Who doesn't love Sam's Club? Moms do. Our moms love Sam's Club. They can get their diapers, they can get their items for the family, so we give them the membership for them to go and shop. Some of the healthy items that we have to make sure they have a healthy lifestyle is our new and exciting OTC catalog. I'm very happy to share this today. Now we have an OTC catalog with CVS, and members can choose items in the catalog up to $20 a month. So they have an allowance for $20. Yes. They can go in-store, they can go online, or they can order via phone with no prescriptions. Did you hear that? No prescriptions. We knew that was a barrier. We knew that was a challenge on the provider. So the new OTC catalog, it's an amazing new benefit, so please feel free to promote that to our members. Again, they can go online, they can go in the stores, or via the phone. So a lot of ways for them to redeem their $20. And I want to mention, the $20 is per household for Georgia Family members, and it's per member for Georgia Family 360 members, so very important. Some of the other things that we have, it's Weight Watchers vouchers. We also cover a gym voucher for the gym membership. We have home meal delivery for moms who are experiencing diabetes. We have our cooking at home catalog. They can also go and pick different items from the catalog as an air fryer, or maybe a set of pans, cooking pans. A voucher to pay for electric and water heating bills, and of course, healthy rewards when they complete appointments. And lastly, we love to invest in our members' future. So we have identification assistant that is a voucher that helps them when they need to go and get their driver's license, or maybe their state ID, or get a new birth certificate. They can use that voucher to pay for that. We also have GED exams. We cover all the exams. We have oil change, BP gas cards, or MARTA passes for students enrolled in college. We have Chromebooks for our seniors graduating high school. We cover college fee applications. So if we have any high school seniors that would like to apply for college, we cover $25 of the college application. And we have our work kit along with a gift card. So we know that if they're getting ready to go for an interview or for the first day of jobs, they can get a gift card for Marshalls or Belk, Ross, and go and pick an outfit and then use the Uber if they don't have transportation. And lastly, we have a new and exciting benefit for our Georgia Pathway members, and it is industry certification assistance and employment flex funds. Those are specific for Georgia Pathways, and it helps them stay connected with their qualifying activities. And if they need help with a specific certification to meet their hours, then we can cover that cost. All value-added benefits can be requested on our website. We have a link to our Benefit Rewards Hub. They can also call our member services. They can see the benefits on the app. They can also access the link on our app. So it's very easy to request these benefits, but also we can go to your offices and help you with this information. We have tons of flyers, materials that we can share with you. Lastly, I'll share, I have an amazing team that covers the entire state of Georgia. They are very busy doing community events. Tons of events happen every single month, and we would love to connect with your offices. If you want an event hosted at your office, we're there. We love doing lunch and learns and appreciation events for our providers. We recently celebrated National Healthcare Center Week, so we love to make sure that you feel appreciated as well. So feel free to connect with me at our table, and I'll connect with your specific marketing rep. And that's it for me. Thank you.
Good morning. My name is, my team. My name is Michelle Anderson Johnson, and I'm the OB Case Manager of OB Case Management. And so today I'll be talking to you about case management. Okay. Let's see. Which one? Okay. Oh, this one. Okay, thank you. All right, so there is a difference between case management and care coordination. So care coordination focuses on closing gaps in care and removing barriers from care. And so what we do with care coordination is we work with you as providers. So if we call your office and say, hey, we have this member enrolled in Amerigroup, and we're trying to reach the member because the number we have is not working. And so lots of times we call the office of the provider to get working numbers, but we also call the provider to work with you to assist the member with removing any kind of barriers to care, whether it be medication, blood pressure medicine, blood pressure cuffs. So that's what we do with care coordination. We focus on ensuring that medical services are received by the member and that they are able to receive all the care that they deserve and need, and that they have good outcomes from that. And then for case management, we work with a higher acuity of members that have more complex needs. They may have just recently been discharged from the hospital, or their blood pressure, blood sugar is uncontrolled. They may have asthma that's uncontrolled. So these are the members that's mostly enrolled in our case management services. So with case management, we provide more education and resources. We also have different programs to assist members, like remote patient monitoring. We have programs that members can receive blood pressure cuffs, and devices are bidirectional. So someone is receiving those blood pressure readings and they can react. They may reach out to you and say, hey, your patient has been consistently having a high blood pressure, and letting you know said that you can adjust your treatment plan for that member. And we work with those programs to help adjust treatments. We also have nutritional counseling for members. We have meal programs that assist members, especially our diabetic members. In our OB case management, we work with Mom's Meals to support our diabetic members and assist them with their pregnancy, and hopefully kind of control that diabetic process while they're going through pregnancy. So we always remain patient and member-centric, whether it's care coordination or case management. We want our members to clearly communicate their needs so that we can assess how we can remove barriers and provide treatment. We help them with treatment options. We help them to motivate them to want to do better, to want to feel better. And so we use a lot of motivational interviewing to help them to reach their healthcare goals. We have interdisciplinary rounds where we have our medical directors, our behavioral health specialists, our behavioral health medical director, and nutritionists that we all will discuss the member. And we also have our pharmacist who's included in those rounds as well. So we work as an interdisciplinary team to assist our member. And then we assess and evaluate that care and those outcomes so that if the member is not showing progress, then we'll bring that member back to rounds, or we'll just continue to work with that member until we can see some improvement in care and outcomes. So these are the different levels. Like I said, care coordination is focused primarily on primary wellness and prevention, removing risk and gaps in care, barriers in care, and then case management focuses more on chronic disease management, and then we have a level where we're doing more intensive case management. We also recently developed a new app. It's a digital engagement platform that our members have access to. And through this app, they can also receive resources in education. There's a health risk log where they can log their blood pressure, their water intake, their glucose readings, and monitors those things for them. And the nurses have access to that platform. So we also can chat with the member if they have questions. And we can enroll them into our case management program, or they can just engage through the app. But a nurse is always monitoring the app to review those outcomes that the members are putting in. So it's really a great process that members are enjoying. They really like working on the app and having that engagement through that app. So that's it for me. I just want to say that, we really, really want providers to be aware of the case management program because we work with you in a partnership to manage care. And so we really appreciate any assistance that we can get from you as providers to help us to reach our members. A lot of times when we call, the number may come up as spam. So a lot of times, just like you see a spam number, you're not going to answer the phone, right? So members are not answering the phone. So we really need you to let your patients and members know that we're here, we're outreaching, and we're here to assist them with their care. Thank you, and I'll introduce Lakeisha.
Good morning, everyone. My name is Lakeisha Williams, and I am a licensed professional counselor here in the state of Georgia. And I'm going to talk to you as robustly as I can, as briefly as I can, because I know we are standing between you and lunch. So I will go through this as quickly as I can, but I want to talk to you about mental health parity, which is a huge priority for me as a licensed professional counselor here in the state of Georgia. And I want to talk a little bit about some of Amerigroup's strategic plan and goals as it relates to mental health parity. First, I want to just remind everybody that mental health parity is not new. This is something that has been in effect since 1996. The law was expanded in 2008 to ensure that insurance providers were upholding the standards as it relates to mental health parity. And so for Amerigroup, we really work to ensure that there is full compliance with all regulations as it relates to mental health parity. And with that, we are working to ensure that there is enhanced access to care. So meaning that it's as easy as it is for you to go see your primary care doctor, it should be just as easy for you to get an appointment with a licensed professional counselor or with an applied behavioral analyst or with a psychologist, as we were talking about earlier. And so Amerigroup is working really hard to ensure that those access to care is available on both our behavioral health and physical health sides of our treatment teams. We also focus on the integration of services. When you see a member in your office, they're not just presenting with that identified problem, right? So they may come in because their stomach is hurting, but they also might be dealing with depression or anxiety or whatever frustrations may come along that are contributing to that stomach ache. And so it's important for us as a health plan to ensure that our case managers, as Michelle just talked about, are asking the right questions of our members to make sure that there's a full assessment of all the things that they need and they can receive those services in the most integrated way. Also, making sure that we provide education to our providers about assessing for every single part of our member, because our members are not just a behavioral health member or physical health member. They are a whole person who's experiencing all different types of problems and difficulties. Next is making sure that there is cost management and affordability. Again, it should not be more expensive for you to access behavioral health services than it is for you to receive physical health services. The copays are exactly the same no matter which type of services you are receiving. And we're regularly auditing all of our practices to ensure that there is alignment and parity across the continuum of care. Some key activities that we've done, as we talked about earlier, provider network expansion. Somebody talked earlier this morning about how long it takes to get in to see a psychologist. And so we are really working hard to ensure that we are creating opportunities to make it attractive for providers to want to be with the Amerigroup and provide services to our Medicaid members. We have our provider incentive programs to ensure not also that there's just access, but that there is quality access. Next up is making sure that we're doing education to our members and outreaching them and letting them know about their rights as it relates to mental health parity and their ability to access mental health services. How many clinicians do we have in the room? Mental health clinicians. A small few. And so we have a big load on our shoulders, right? And with that, really being able to educate our physical health providers about how do they tap into those behavioral health resources? How do you get a referral over? Who are you sending it to? So that there's education among our PCPs, obstetricians, whoever it is that that member might be going to see about how to get into those actual services. Technology and innovation. You heard Michelle talk about our app that we have available to our members. We reach out to our members in a myriad of ways because we know we live in a different society today than we did 20 years ago, right? And so a phone call might not be the most effective way for us to reach our member. Maybe it's a social media campaign. Maybe it's an app. Maybe it's, us doing canvassing at some type of fundraiser or walk. But in any way that we can be innovative and working with our members to make sure that they are aware of the mental health services that are available, Amerigroup is leading that charge. Next up is ensuring that we have quality improvement initiatives as well as training and development. Again, this is related to our providers and making sure that we are incentivizing our providers to deliver quality behavioral health treatment because, again, we don't want to be reactive to our members who are having difficulty in the behavioral health space because, as we know, when you get to dealing with a member who's had years of behavioral health issues that have gone unaddressed, it could be very hard to make progress. And so we really want to be as preventative as possible and really provide quality treatment to our members and also ensure that our providers are actually trained up to be able to serve the needs of our behavioral health members. And then, of course, advocacy and partnership. Amerigroup can't do this alone. We work with NAMI, we work with DBHCD, we're working with DCH to ensure that when there is a mental health parity issue, that it's brought to our attention and addressed as swiftly as possible. Some of the most complex areas to address when it comes to mental health parity, of course, is the interpretation of laws. I'm sure many of you probably haven't sat down and read the mental health parity law. And so we've taken on that burden for you and really worked to ensure that we are in alignment. Of course, there's always going to be difficulties with network adequacy. However, Amerigroup has taken a concerted effort to really work with the providers that we have to figure out how can we train up the providers that we have. Right now we have a trauma-focused cognitive behavioral training program that we're offering to providers. We've done DBT trainings in the past to really be able to expand the workforce that we have because we can't create bodies, right? But we can try to upskill those clinicians that we do have in the network. We also are working to deal with stigma. Behavioral health has really gotten a lot more attention in these last 20 years than probably ever before, especially even the last 3 years since the pandemic. However, there's still stigma attached to just talking about mental health. And the more we say behavioral health, mental health, depression, anxiety, I love to be able to talk about that and be able to remove the stigma that comes along with talking about emotions and feelings. And so for us, that's an area that's been hard to address, but we attack it head on and ask our members about it in every conversation that we have with them. Are you feeling sad? Are you feeling lonely? Because sometimes people don't connect with the word depression. No, I'm not depressed. I don't feel depressed. But they may actually be experiencing that. And so the way that you ask those questions is a part of our strategy to address and ensure that there is parity in the treatment that we provide to our members. And then again here, equitable access as well as technology and telehealth. Some of the lessons that we learned is just the importance of clear communication. Again, just like I talked about, how you say the things that you say to a member when you ask them what's going on with them. We all have to be sensitive to the fact that everybody understands things differently. And what they will say yes to depends on how you approach or ask a particular question. And that's where that cultural sensitivity comes into play. And we provide lots of training to our teams about the importance of communication when we're talking to our members. And that's not just for the behavioral health team, but across all departments, understanding. So our physical health team, our pharmacists that are talking to members, you know, our physicians that may be talking to a member, making sure that there is cross-departmental training about how to actually specifically address behavioral health issues. Of course, regulatory nuances matter. There are different states that have different laws and different rules, and so making sure that we are aware of the state-specific requirements. Also, data collection and ensuring that we can actually measure how effective is our parity. Is there actual equity among the treatment services that we're rendering to our members? And then being flexible. When things aren't working, how quickly can we change them? How open are we to feedback from our members about what they can't get and being able to pivot when we learn about those difficulties? These are some more lessons learned. Again, financial considerations, member feedback being invaluable. And then again, I just want to highlight the importance of addressing stigma, which requires a multifaceted approach. Us being able to meet the members exactly where they are in the way that is most appropriate for them. Some successes we've had with mental health parity: we have maintained full compliance. We have not had any parity failures or failed audits. We've been able to maintain full compliance. Again, access to care, we've been able to expand our behavioral health network significantly over the last 5 years. And also, we have seen a huge increase in utilization of behavioral health services, which is a positive for us. We want to see our members actually requesting authorization more. Somebody asked about, you know, ABA services. We've seen a triple amount of ABA requests come in over the last 3 years for those services. And then again, of course, early intervention for behavioral health treatment. Quality of care, we talked about some incentive programs that we have for our providers to ensure that we have good clinical quality outcomes, as well as assessing and providing surveys to our member population regarding their satisfaction. Care integration, ensuring that our case managers are able to address both the behavioral and physical health needs of a member, and also ensuring that there is appropriate engagement and assessing on those metrics as well. And now I'm going to turn it over to Abby to talk about Georgia Families 360.
All right, good morning, everyone. I'm Abby, and I'm representing the Georgia Family 360 program. And before I jump in, I have a very important question to help me today. How many of you all are hungry? Okay. How many of you all are hangry? Okay. My goal is to make sure the number of hangry does not increase while I am at the podium. So I'm going to be quick because, like Lakeisha said, we're standing in the way of an important part of our day. So one of the initiatives that we have as a part of the Georgia Family 360 program is a new platform that we're calling Care 360. And Care 360, you all as providers can access it via the Availability portal. And what this offers to you is a really comprehensive look at a member's health history since they've been with the Georgia Family 360 program. So as a provider, you can log on, you can see who their care coordinator is, you can see their diagnosis, their treatment history, prescription history. We really are trying to give you as much information as we have as a part of their health history that can inform and help you in your care coordination and your treatment. There's even the member ID card that should be on there as well, and I know sometimes you all need that information too. So check that out on Availity. We're doing a soft rollout, but you'll be seeing a lot more kind of a hard launch of this program with some communication around it, but just wanted to introduce it to you all today. The next thing that we have, some of you all may be familiar with our GOMO program. We launched this with our autism and 0 to 5 population, and this is an interactive and personalized texting engagement platform that we offer to our members. We are expanding this for our transition age youth population, so this is for all members between ages 18 and 26. And then our families that are enrolled that do not have child welfare involvement yet, but may be at risk of some involvement there. So they have access to this engagement platform to really make sure both entities have access to resources specific to their needs and specific to how they're answering the text to make sure it's really personalized. Another thing that I wanted to tease, and we always tease, is our education and training team. So some of them are here today. They are hard to miss. One looks like a literal angel. She's in the back of the room. Marcus, our manager, he has some really fun black and white pants on. So there are 2 of them here at least. If you want more trainings, if you want to know more about not only Amerigroup, but different topics that are applicable to how you all serve members, find them. They have kind of pre-made trainings, but they'll also tailor trainings to whatever your needs are. So just wanted to call them out. Their information, the email's on the slide, but also find any one of us or find them and talk to them about how they can help support your needs. And then almost last thing, we are still rolling out the trauma-focused cognitive behavioral therapy certification and training. So we've had several cohorts, one in the South, we have one in Atlanta, a training coming up in a couple of weeks, and then we're gonna be continuing this into 2025. So if you are interested in this, also grab one of us, grab our training team. They'll be happy to give you more information about how we can get you enrolled in that. And then one thing that's not on this slide, but it's kind of hot off the press, is we wanted to share that we have continued a partnership with Comfort Cases. And what Comfort Cases does is they make sure that all kids in child welfare have access to their own backpack. So they're not carrying around trash bags, they're not lugging their things and kind of things that don't bring them dignity as a part of their transition. So we are going to continue to work with them into the new year to figure out how we can work with the state to eliminate trash bags for kids in foster care and make sure that they have something that is their own, that shows respect to them, and that really shows them that there are people out there that care about how they're able to proceed in the community. So we are working on that. We are very committed. We've provided and supported over $500,000 with Comfort Cases to ensure that all members in Georgia that have child welfare involvement get access to one of these cases at no cost to them. So this is something, our 1-year anniversary is tomorrow, and I would be remiss if I didn't tease that as well. And last but not least, coming from the care coordination side of the house, I'm always going to tease and remind you all, every GF360 member has a licensed clinician. So if you ever need help with a member's care to really ensure that we're partnering together to provide care for our members, just know that there is a care coordinator there. You can find them on Care360. You can find contact on our website. Grab any one of us, talk to anyone at Amerigroup, and we'll make sure we let you all know who their care coordinator is. Okay, I am done, and I guess we'll take questions before lunch.
Hi, this question is related to provider relations and claims. I manage a large pediatric PHO, and since August, providers have been disenrolled off of Amerigroup, and it's causing claim issues, PCP alignments. We've been working internally with our dedicated Amerigroup rep, but it seems to be just a ricochet effect. It gets fixed, it gets broken. and providers are very upset with the network because we're not giving them the resolution that they expect, and I just want to know what's being done to address the issue.
Thank you for that question. First of all, I do want to say we have a claims table here today, so you are welcome to visit that claims table so that they can work on resolution of your issue. As far as the systemic issues, we are aware that they have occurred, and we are definitely working on fixes for those. You can work through your provider rep as you have done, but I also serve as a provider ombudsman. And so very often, we refer to like that Staples commercial, making it easy for you, right? That was easy. That's my role. So if you do continue to have those types of issues and you're working through that process, you can also work with me to serve as your liaison to try, once you bring it in, I'll do all of the work behind the scenes to try to get to resolution for you. And so that's what I would recommend today is to go to the claims table. They can talk with you about whatever you have outstanding today. And then also I can give you my contact information if you have any additional concerns. Absolutely. Then come see me, right? I'll be out here and I'll get your information and we'll be in touch to get that resolved. Thank you.
I'm the owner of a pediatric office in Fort Oglethorpe. We provide PT, OT, and speech for children. I want to propose a solution to a longstanding ongoing issue with regards to obtaining the speech authorizations and the requirement for submitting hearing screenings. We're having extreme difficulty getting those for our children with autism. I have looked for where the requirement is documented. There's nothing in the Children's Intervention Service Manual requiring hearing screenings, and all I found in Amerigroup was an attachment 1 to a 2018 utilization management guideline for children's therapy. Children with autism cannot participate in a standard screening process, and their services are being limited to 1 month for the parent to try to get those screenings. And or they're being further delayed because a parent has tried. We're now hearing that an IEP is acceptable. Well, how does that ensure that their hearing was screened by the school if they can't participate in one? And then the final alternative is to actually sedate a child, to send them to the audiologist to test their tympanic membrane to make sure they can hear. There is an alternative, and it is called Music to My Ears. I brought a sample to show you at your table. We have tried to submit this in the past, and we were told it is unacceptable. On their website, they clearly say it is very useful for special needs children and for those with autism. So I'd respectfully request that we be able to submit the Music to My Ears results as a screening tool for our authorizations for our children with speech.
Thank you so much for that feedback. And we actually have our manager over our outpatient UM team here, and so maybe Ibrahima can meet with you after this meeting to talk more about that. So thank you for sharing. Ibrahima?
Thank you all for coming. Russell Carlson had stepped up? Awesome. Yeah, Russell Carlson, the director of the DCH, is going to share a word.
Thank you, Brenda. And it didn't lost on me to your very accurate commentary earlier on hungry, hangry lunch. I get it. I've spoken enough Rotary clubs to where I can tell they're looking at their watch. It's time for this guy to shut up so we can get on with our day. But no, I'm very grateful that all of you are here. I appreciate the DCH team being here, making themselves available. Amerigroup and all of our partners. Thank you guys for making yourselves available. Basically, for just what happened here, the exchange of ideas, new ideas, or how we can take existing policies and do them a little bit better. or more efficiently, how we can embrace newer technologies and new approaches to hopefully make this big machine run a little bit smoother than it ran yesterday. It's always something that we all have a lot of day-to-day, go, churn, but somewhere in our large department, and I'm sure in y'all's organizations, you're always trying to at least spend a good amount of time trying to look over the horizon and see what future state might look like and make strategic decisions on how we can do things a little bit better for you guys. It isn't lost on us that who's on the administrative side and who's in the field, actually the arts and sciences of delivering care. And these are your communities and your neighborhoods and people that you know their families. The old example that politicians use a lot, like the gallon of milk, you know, like you go, you can do town halls all day, but when you're running an errand or going to church or whatever, you're seeing these people. They're your partners, they're your colleagues, they're your neighbors. So I really appreciate those of you who deliver services to Georgians. I'm glad you're here informing us of what you see and how we can take that back. And I hope DCH for some time in the past and moving forward, I hope sometimes when you see us pivot on something or change a manual or change a process, more often than not, we didn't pick up on these things in some big lecture, you know, on the conference circuit. A lot of times when you see changes being made, it's from things that we have learned from you. And I know you're trying to hide Brian down over there, but I've always complimented Brian on how, you know, town halls across the state, constituencies across the state, he always leans into that. Sometimes knowing that it might be a frustrated audience, but he goes and he has an exchange of ideas and he learns something every time he comes back and educates us on things that we might consider. So I'm very grateful for the exchange, the conversation, the dialogue. Thank you again for all of our partners that do so much and a lot of times are shoulder to shoulder with you in the fight. I know it's Halloween, so everybody enjoy your lunch, because if you're anything like me, you're probably about to have like Snickers and Twix for the next 6 weeks. So maybe let's all go eat an apple or whatever we need to do on the healthy side, because it might be the last time we do it. And for those of you who take a step further, for those of you who partake, a lot of us, it's Georgia-Florida week. So we're all trying to think through our menus for the weekend. Go Dogs. I may or may not be leaving early tomorrow to go to Jacksonville. I'm just saying that might be happening. So if you need me, I'll find you Monday. I'll return your call Monday.